Hello, this is Dr. Neil Baum from New Orleans, Louisiana, and I would like to take about 5 minutes to share with you the concept of having proper etiquette with telemedicine or virtual visits. Unfortunately, at this time, there is no Emily Post book on etiquette for virtual visits. But I'd like to share with you a few suggestions that I think can enhance your relationship communicating with your patients. From 2,500 years ago, the concept of medical care consisted of taking a history, performing the physical examination, providing a diagnosis, and then instituting treatment. Since March of 2020 and COVID-19, we have found that it is possible and even safe to manage patients without having to touch the patient or to examine the patient. Here are 9 suggestions that I think that will enhance your virtual visits. Number 1, avoid any non-distracting background. Make it very plain and simple, and avoid any glares or reflections. Second, ensure privacy. Turn off all mobile phones, avoid any extraneous noise, remove all papers and files on your desk, and if you are doing it for home, I suggest not encouraging your children and your pets to participate in the virtual visit. I think you have to dress as if you are in the office with the patient, and that means a shirt, tie, lab coat, or a scrub suit. Number 4, be on time and respect the patient's time, as many patients are working remotely and have other obligations or are helping with their children. Number 5, review the patient's chart. Do this before the virtual visit so you're not looking at the chart or other papers while you're communicating with your patient. Number 6, don't look at the screen, but look at the webcam, which will give a more enhanced communication than if you're appearing to look elsewhere rather than at the webcam. Number 7, give it your undivided attention. This is not a time for emails or multitasking. Number 8, be sure to answer all of the patient's questions at the end of your virtual visit. Make sure that any question that they have is completed, answered, and taken care of before terminating the visit. And last, number 9, ask for feedback. Ask the patient, how did I do? Did this meet all of your needs? Was this as good as an in-office visit? And any suggestions that they may have for enhancing a telemedicine visit. The bottom line is that there are no golden rules for virtual visits at this time, but you can provide safe, excellent care and demonstrate empathy and compassion even if you can't touch the patient. If you have any questions regarding teleetiquette or you have suggestions for enhancing teleetiquette that you have used in your practice, please let me hear from you at the email address provided on the last slide. Thank you.